Hydrofera Blue came out of a collaborative effort between Hydrofera, the company, and Dr. Edward Shambrom at the University of California, Irvine, the Infectious Disease Lab. He has been a pioneer in blood products for over 50 years.
Hydrofera Blue is made from polyvinyl alcohol or polyvinyl formalfoam. We came across the polymer years ago, and I felt there were several applications in the medical device field that weren't being exploited. Dr. Shambrom and I had started a relationship with a prior company. PVA is a very pure substance. It burns clean, it's clean to the environment, it's close to natural sea sponge as you can possibly get.
Hydrofera became a byproduct when we took the two dyes and they were bound to the white PVA, and we had a material that would eradicate bacteria, fungus, and viruses.
Our pore size ranges between 20 and 40 microns, very small. And that tight pore structure aids in the wicking ability of the material. Obviously, it's a hydrophilic material, so that also helps wick. But those two things basically provide a very unique, natural negative pressure.
The Hydrofera Blue has a unique property which appears to be very different from the other products on the market. It almost acts as a wound vac.
Hydrofera pulls continuously and automatically from the wound bed through its capillary flow and negative pressure.
In addition to the pulling of bacteria out of the wound by the Hydrofera, when you remove the Hydrofera sponge, you can actually see physical debridement of the tissue as the sponge itself clings to the dead tissue and removes the dead tissue.
Hydrofera Blue gets its distinctive color from the two organic pigments that are in the product, which are methylene blue and gentian violet.
The two dyes have shown to be effective against all types of bacteria, fungus, and virus, even those that are resistant to standard antibiotics.
The two dyes are extremely gentle in the process of killing bacteria, yet they don't harm healthy living cells.
When bacteria is wicked up into the polymer, where it then interacts with the pigments, the bacteria is effectively killed, cleaning the wound bed, which really allows healing to be facilitated.
When the bacteria comes in contact with the two dyes, the attraction between the dyes and the bacteria is stronger than the dyes to the foam.
Given that the product is blue, you can tell over time as it's acting on the wound bed. Often the product will eventually turn white, and that sort of signals that it's time to change the dressing.
Wound changes for people who have extensive wounds can be difficult. Some patients have to be pre-medicated just to do a surgical wound change. When Hydrofera was introduced, that no longer was the case.
I think what Hydrofera is doing is exerting an immediate anti-inflammatory action on the wound. Inflammatory substances such as cytokines, oxygen-free radicals are being continually wicked away from the wound and into the matrix.
This clearly has an analgesic effect, which again improves the patient's quality of life and potentially accelerates the rehabilitation process.
Our first initial patient had 11 wounds open for 4 years and had not healed, and we were able to close all of her wounds within 20 weeks.
I think the ease of use, first of all, with the Hydrofera Blue is the numerous wound types that this can be used on. It can be trimmed to fit the shape of the wound as the wound changes size.
Hydrofera is an important wound care product. Not only is it easier for the patient, it cuts down on pain, doesn't have to be changed as often. The tissue seems to heal faster. It cuts down on the amount of drainage, so the bacteria is being pulled into the sponge as opposed to laying into the wound or around the surrounding tissue, which can cause more infection.
The second time I came across the product was in a patient who had had an amputation, obviously had significant vascular disease leading to his below-the-knee amputation. He was quite slow to heal, had been in the hospital for weeks post-operatively, and what we found over the course of his treatment was he had rather impressive recovery with his wound that seemed to be accelerated by the product.
Hydrofera Blue works because it's a very simple yet unique complex. A matrix basically that provides negative pressure, a moist wound environment, pain relief, the reduction of bioload, and the elimination of harmful pathogens from the wound bed. All of this works aiding patient compliance and the healing process itself. The case for Hydrofera is that it works.